State Health Department reports there is more flu activity across all age groups this year than the last two flu seasons. And here today to give us an update on our area is Tim O'Connor from the Florida Department of Health, Palm Beach County. Tim, good morning.
Good morning, John.
We're calling on you again, obviously, because there's a lot of concern this season about that, right?
Well, it was, you know, and the last time we visited, we were just in mild, sporadic activity, but just really in the last week, we've seen a spike in the flu. So we're now in that whole moderate range. Senior homes are seeing it. You know, we're seeing a little bit in the schools and other areas.
All right. So how do we compare to maybe the rest of the state, maybe the rest of the country?
Well, right now there are 6 counties in the state that are reporting moderate activity, and then the rest are all still reporting mild activity. But overall, it's rising daily. You know, those reports are coming in. We're seeing it, and of course, nationally, they've got some pretty high numbers that are going around.
I think the other day we reported every state has significant flu activity except Hawaii.
That's correct.
Right?
That's at this point, and you know, we're in an advantageous position here in Florida. The other continental United States, if you will, you know, it gets those colder climes. We in Florida generally see it later, and we're seeing it now later, but still earlier than normal.
Right, yeah, and stronger than normal too. All right,
yeah,
so
exactly.
You pointed out a couple of the areas. What are some of the areas that are most prone? Is it schools, nursing homes?
Well, the high-risk groups, you know, you have pregnant women, nursing homes, people that are greater than 65 years old, equal to or greater than 65, and of course school, children, you know, and preschools especially.
And a lot of areas where people congregate, you spread germs.
And that's exactly what happens, you know, especially like in your daycare centers, your preschools, or school in general. You know, there's a lot of personal contact coming along.
And kids, no matter how much you tell them, they forget,
and, you know,
accidentally on purpose to wash their hands sometimes.
And it never, and they generally don't cover their cough, you know, with their whole arm. You know, they'll cough on a friend just to be, you know.
Yep. So, all right, so the best way to deal with it is obviously not to get it. So prevention is on everybody's mind. Any tips?
You know, the main thing, you know, if you can, get a flu shot. It's still not too late. You know, it takes about 10 days to take effect. So if you haven't had one, get it soon. Sooner than later. But from there, you know, if you are sick, you don't pass it to another friend. Stay home. You know, that's number one. And when you're in the office, when you're at your business, you know, if you cough, you know, cover that cough, cover your whole mouth. Wash your hands regularly, you know, so it doesn't spread, especially if you're somebody who was sick and you touch some of that surface, you go hand, eyes, mouth. So, you know, take those general necessary precautions, but again, if you are sick, go home, stay home until you're better, at least 24 hours after the fever subsides.
A lot of folks have been calling in, you know, because of this. So, yeah, it's understandable. And wash your hands. That's the best prevention right there. Or not to get it in the first place.
Well, the best one is not to get it. And I'm keeping my fingers crossed, and I hope you are too.
All right, Tim. Thank you so much for
updating us.
I appreciate it.